Hello, everyone. We're joined by Siddharth Bagga, who heads Google Healthcare in India. It was a wonderful session that we came out from where he gave us a lot of information on how Google is transforming healthcare in India through artificial intelligence. So, Siddharth, healthcare represents 30% of the world's data. So, how does Google Health ensure that the data is not breached, which can lead to exposing the patient's medical information?
So that's a great question, right? There are two aspects of Google. One is Google Health business, and then there's Google Cloud, which I represent. I lead the healthcare business for cloud in India. At Google Health, we build products today that are adopted at scale. Great examples are, Fitbit and the Pixel phone, and all of these have strong health elements built into it. And inherently, Google builds security into its products from day one. So we look at security and securing patients' data and general personal health information data from the time we start developing our product. So it's not an afterthought. So we ensure that all the data that you are using on your Android phone or on your Fitbit watches or so on and so forth is only yours to remain, and it only stays with you. There's a lot of consent management that goes into how your data can be shared. It's all in control of the end user and of the consumer, right? So that's one part. At Google Cloud, what we do is we work with our customers today, and I spoke about the work we do with Apollo, with Manipal, and all of them. All of this is at the heart of data, right? How you leverage this data to then drive experiences for either doctor or consumers. What we do is when we work with our customers, we make sure that security is at the center of whatever they put on Google Cloud. So as an example today, any data today that is in Google Cloud is encrypted by default. Any data that transfers from one place to the other is encrypted by default. Any data that you use for artificial intelligence can be de-identified very easily on Google Cloud and synthesized, right? So there's a lot of tools that we have today in the arsenal, in the platform, that allow you to manage security, manage the security of your patient's data, and also ensure that PHI does not get leaked out, right? Great example is that Google Cloud has never faced a cyber security attack till date. So it's a great testament of how seriously we take security at the heart of all our products. As Google, we have 10 products today that have over 1 billion users, and knock on wood, we've never had any adverse incident. So that should bear testament to how we manage security anyway.
I was coming to the wearables.
Yeah.
Google has wearables like Fitbit.
Yes.
Yeah, so it gives us so much of information.
Yes.
But there are people who say that it leads to a certain kind of obsession among people, where they say they set unrealistic goals and ensure that everything happens according to a set pattern.
Yeah.
Do you think it could lead to further problems, being like setting unrealistic targets?
Not quite, right? I don't think wearables today, and be it Fitbit or be it any of the wearables today, are not, the goals are set by you, right? The goals are set by the consumer at the end of it. All wearables are doing is enabling you to take better control of your health. It's really about how do you get your personal healthcare record, and how do you understand your personal data in a much more better fashion, so that you can lead healthier lives, right? At the end of it, if you can exercise more, if you can track your nutrients in a much more better fashion, it helps you to lead a healthier life. It can bring down risk of diabetes and so on and so forth. So targets and goals are set by you. It's a great program that we ran with Manipal hospitals a couple of years back, with Fitbit on helping patients who come out of orthopedic surgery and cardiac surgery. How can doctors help them lead healthier lives once they're out of surgery? So great way to look at outpatient health, right? Because doctors today, once the patient is out of surgery, they don't know what's happening with the patient. Right? So it's a great way to look at how you can use wearables data and other data to provide information to the doctor, so that the patient out of surgery is leading a much better and healthier life.
The mental health care is getting destigmatized.
Yeah.
So, what is Google looking at on that aspect? Are you looking at applications that can reduce stress, that can bring in mindfulness? Are such apps on store? Like,
Yeah, so absolutely, right. So I think mental health is a huge issue in India, right? I think 6 months back with Apollo hospitals, we launched a mental health screening tool. That mental health screening tool was made, built between Apollo and Google in a way for you to go into Google search and start doing mental screening, right? And it was a simple radio button kind of answers how you're feeling, have you been depressed, etc., etc. And it was helping customers understand their or helping consumers understand their mental health status, right? So that's like a huge mission for us, and simple tools like this today available on a surface like Google search is a massive boost, because that's where people come to search anyway. If you have anything today with health or otherwise, you will go to Google search, right? So we built out this mental screening tool specifically for India. Apart from this, there's a number of things that we do, right, in our first party products. If you're a user of Pixel watches and Fitbit, there's a lot of things that we do around mindfulness, understanding your stress, and so on and so forth. But we also work with customers of Google Cloud today that are building out applications for mental health, right? So we're using generative AI, we're providing our foundational models on generative AI, which is called Gemini, to customers of Google Cloud to leverage generative AI, Google Cloud Gemini models to help patients understand their mental symptoms and mental health systems in a much more efficient manner, right? So with the power of generative AI, now that you can, essentially ask questions in natural language and the model can give back answers in natural language, that's a huge boost. And we're seeing a number of these applications today using our foundation models being built and deployed on Play Store.
So the specialized diagnostics is limited in rural areas.
Mm.
So what is Google doing from its side
Yeah.
to ensure that it is more, it reaches as many people as possible,
Yeah.
is more effective in rural areas?
Yeah. So one great example is the work that we did with ARDA, which is automated uh, retina diabetic analysis, right? So basically, what happens is when you do an eye scan, right, there is a way for you to understand whether you have diabetes, right? So we worked with about 9-10 years of work that went into developing this model and actually embedding it into the camera of the when you do an eye test, right? So we partnered with Arvind Eye Hospital, and we took it all over the country, and that's a model that's very successful. It's being deployed in rural areas, etc., where doing a diabetes test becomes a problem. But you can carry these fundus cameras and do a scan, and in the scan of the eye, it will tell you if you have diabetes, right? Which is to diabetic retinopathy. That's what the term is called. The second thing is, I just played a video of the work we're doing with Apollo for tuberculosis. That's another very interesting area where we've collaborated with Apollo to build AI models to help doctors understand and radiologists understand whether a patient is at risk of TB, right, or early risk of TB. It helps them in that sense. And the whole idea is that you can mount an X-ray machine, go to a rural village, do an X-ray, and that image can be transported back to a central location of Apollo, and then from there they can understand whether the patient has tuberculosis or not, or is an early stage of TB. So that's the kind of work that we're doing today. So these two are the great examples, but of course there's a lot more other things that we're doing. Yeah.
Google's advancement in AI in healthcare, would it lead to more jobs in medical science? Is a genuine question that we
Yeah. So I mean, I think skilling with artificial intelligence is a huge area of development, right? I think it's not about, hey, is AI competing with me? I don't think that's the intent. The intent is, how can I use AI to do my job better, right? There will be 20 to 30% tasks that will be repetitive in nature, right? But you can perform it with 90% more efficiency with AI, right? And that is in general, and even more so applied in healthcare, right? So will AI replace a doctor? No. Will AI assist the doctor? Yes. To build those AI models, do you need engineers? Definitely yes. Do you need people who understand healthcare to work with these engineers? The answer is yes, right? So overall, if you see, the shift that will happen is towards, how can I skill myself better in AI, and how can I combine that with the healthcare expertise that I have to make sure that the systems we're building for the next generation are enabled with technology in a way that can really help you do things faster in a much more efficient manner and do it with certain accuracy, right? So that at some level, you are providing a doctor in some sense a next best action platform based on what you have seen in the past, right? So think of it like an assistant for a doctor as an example, sitting along with the doctor, working around the doctor. But to build that system, you need engineers, you need people to do research. So it will fuel a whole kind of pipeline of skilling that will be needed.
You were talking about how one of the hospitals in the country was suggested something because people were finding it difficult to read the prescription forms
Yeah,
of doctors.
correct.
Yeah, so that is an issue that most people face, most
Yeah.
chemists face. So how do we tackle it with AI? Like,
So I think it's a great example that I showed of how Manipal Hospitals is doing it, right? Manipal Hospitals today is leveraging our Gemini model to look at doctor handwriting prescription and generate a digitized prescription within 10 seconds, right? So it's actually fantastic because if you upload a handwritten prescription on the Manipal Hospitals platform, which is an e-pharmacy platform, it will give you a digitized version in context. It will contextualize it. It will put it in a structured way for a layman to understand, right? So it's massive, right? It's huge, and Manipal is doing it. There'll be lots of others that will end up doing this, and I think the scope of the technology is massive, right?